Hi, I'd like to talk to you about baggy lower eyelids and eye bag surgery, one of the commonest procedures I perform here in my London practice. Eye bag surgery can be quite challenging, and this is primarily because as we're aging, we're losing bone in our cheek. And I'd like to show you what happens round about the age of 35, where we're losing the bone in the anterior cheek. And as this bone resorbs, and of course it doesn't resorb as quickly as this animation is showing, it creates a loss of support and the cheek fat pad shifts downward. We also have an expansion of the eye socket, and this eye socket expansion, along with the loss of the bone in the midface, creates a domino effect where the fat pads that are being held in place by these bony structures are lost. And therefore, one of the early changes when you get an eye bag is actually primarily a bag prolapse or a fat prolapse that has become visible because of this downward shift of the anatomy. And so as this domino effect occurs and the fat pads and the face indeed appears to be shifting, this is what will start occurring in the under eye area. You just get a little prolapse of fat. And when it's at this stage, very often people do really well with under eye fillers because by giving back the support to the midface and the areas where the soft tissue volume has moved, we can restore back this prolapsed fat pad very nicely. So under eye fillers can be used very easily in the early phase. But as the fat pads progressively stay in that position, they can also become enlarged and they can get hypertrophied. So in fact, they are now like a hernia rather than just a prolapse of fat. And this is when eye bag surgery becomes necessary. So let's talk about the different types of eye bag surgery. The commonest surgical procedure that I perform is a scarless lower lid eye bag surgery. This is called a transconjunctival blepharoplasty, where the cut is made from the inside of the eyelid. There is no visible cut on the outside of the eyelid, and that little bit of fat that has become visible, that eye bag, is just removed or repositioned. What do we mean by repositioning? So if I show you this model of the lower eyelid, the fat has prolapsed between this gap, and either we take the fat away or we reposition the fat over this rim so that we're also correcting a tear trough hollow and volumizing the under eye areas. So this is all done without putting a scar on the eyelid, but it's called a transconjunctival approach. Now the transconjunctival approach is ideal if you have skin without any lines or wrinkles and you have taut under eye skin. So we tend to do this more commonly in the younger patient. When you have loose skin or you have a loose eyelid, it's much better to have a cut put on the outside where the skin and the eyelid is tightened simultaneously with removing the prolapsed or the hypertrophic fat bag. Now I often use combination treatments. So with the scarless surgery, because my patients like the quick recovery, they don't want a scar on their eyelid, I still use the scarless approach in my older patients with loose skin. So I'm taking the fat bag out from the scarless approach, but then I either combine it with a smaller procedure on the outside where I'm just doing a little skin pinch with a canthopexy to tighten the outer lid, or I can then combine it with Tixel resurfacing where I'm tightening the skin using a device that is similar to a CO2 laser in terms of skin tightening so that they don't actually have to have a scar on their eyelid. The downtime is slightly different if you have a scarless surgery versus if you have a transcutaneous or a surgery which puts a little scar that's hidden just below the lashes. So most patients with a scarless procedure would recover within 2 weeks, and most patients with a scarred procedure would be bruised and swollen for a couple of weeks, and then they would gradually and progressively recover between a 4 to 12 week period. A lower lid eye bag surgery is performed under a general anesthetic, but it's a day case, so you come into hospital and you go back home the same evening. and most people can go back to work 2 weeks after the surgical procedure. I hope I've answered some of your concerns about eye bag surgery, and if you have any further questions, please don't hesitate to contact the team at Perfect Eyes Limited.